1, 2, 3, testing. Oh, 1, 2, 3. Hey, what up, y'all? It's me, your boy, Lil D, coming at ya from the den with another nursing video. And in this video, I have a question for you. Do you hate your current nursing job, or do you feel stuck in the position that you're in? Go ahead, keep watching this video, and let's get into it. I was watching a nursing video on YouTube, and there was a girl talking about how she hated her current job. She hated being a nurse. She had been a nurse for 3 months, and I just didn't really like that. Reflecting back on my career, though, my first year of nursing, I remember thinking, what am I doing? Because it was so hard, and I think I was in the same mind space that this girl was. Now, I don't like wasting my time, so when I commit to something, I fully commit. And anyone who has gone through the nursing program, it is probably the most toughest thing ever. Like, anyone who is a nurse can agree to that. And I think it would be a waste of anybody's time to go through all that nursing and then finally get in the field to get on a unit and decide this isn't for me, because there's so many opportunities in nursing as a whole. The first thing I want to say is communicate to people. If you're unhappy in the position that you're in, try communicating to the people on the floor. Open up, because no one knows what you're going through unless you tell them. Now, this might be easier said than done, because coming onto a unit, you're not knowing so much. As a new grad, everything is so overwhelming, but just being vocal and getting other people's opinions can really make you feel a lot better. Like I said, nursing is such a huge field. If you're unhappy in the position that you're in, try a different field in nursing. If you're a neurotele on a unit, maybe try going to a nursing home, or maybe try going to home health and going to people's homes. Or if you want to get away from that kind of patient care altogether, maybe try going into case management. There's so many opportunities. Or there's one thing that I always wanted to do, which I never did, but that was go into surgery. I just thought it would be so cool to say that I worked in the surgery room, even though the doctor does most of the procedure. Well, I mean, pretty much all of it. It is something that I really wanted to do, and if I ever got sick of the unit that I was on, I always said that's where I was going to go next. Now, my third recommendation would be to continue your education. We're nurses, we're all educated here, so we value going to school. And it seems weird going back to school if you're telling someone that you hate the job that you're in, but going back to school can also open up a whole lot of opportunities. My friend, she went over to teaching. She actually gets paid more than floor nurses, and she didn't like floor nursing, but she's teaching now. And that's something that if you ever wanted to be a teacher, you could do that as a nurse. I don't know how I got into the role of nursing. That's a completely different video, but I've always been pretty fond of computers and pretty tech savvy. So what I'm doing is continuing my education to get into a role of nursing, but that revolves around computers and helping the patients and the nurse. So it's like I'm leaving this job, which may not be my dream job, but I'm working towards something that I do think could be my dream job. All of this information may seem much easier said than done, but you're really only as stuck as you allow yourself to be. If you are not happy in a situation that you're in right now, don't just throw it in the trash. You worked hard for that degree. Bring it back in, keep pushing forward, or apply for something that you do want, because there is so many jobs that you could do in nursing, and you shouldn't ever have to feel stuck. That is it for this nursing video. Go ahead and give it a like, and make sure you subscribe. I'll put my latest video, we'll put it right here, because this is a cute little setup that I got. But I'll put my latest video right here, and I'll talk to you guys later. Thanks. Bye.